Welcome back, everyone, to Tooth Talk Tuesday. It's National Children's Dental Health Month, and this week we're talking about emergencies. No one ever plans to have one, but I'll give you some tips to be better prepared just in case. There are different degrees of dental emergencies, anywhere from a broken jaw to just something stuck between two teeth, or maybe a bitten lip. So I'll give you some do's and don'ts, when to call, when not to call, and what to look for. It'll help you when that time comes, or if that time comes. A serious dental emergency is when a tooth is avulsed, or what you would commonly call knocked out. 2 million teeth a year are knocked out. If it's a primary tooth, or a baby tooth, 6 years of age and under is usually when those are in the mouth. Don't worry about it. Call me, get in here. If you find the tooth, you can keep it. I'll tell you how, but it's more important to preserve permanent teeth when the child is a little older, starting at about 7 or 8, the front teeth. And boys are worse at this than little girls are, but the sooner you get in, the better. If you can locate the tooth within 5 to 10 minutes, pick it up. Don't rinse it off. You want to get in here as soon as you can, and the safest, fastest, easiest thing to do to keep it moist is to put it under your tongue. The mother, the father, whoever can ride in the car. If not, you put it in your mouth under your tongue and get in here. Call the office. You'll get my emergency cell phone number. I'll meet you here as soon as possible. We've got about an hour to get that tooth back in and try and preserve it. If you don't want to put it in your mouth and you see little tags or dirt on it, don't wash that off. Don't pull those little tags of tissue off. Get it in some milk. And if you don't have milk, maybe a little bit of water with salt. You have to keep it moist. The time is of the essence. We have to get it back in as soon as possible. The other thing that can happen is a broken jaw. You've got to get to the emergency room immediately. And there's swelling, there's a lot of blood underneath the skin. It may be that the bone is even protruding. You'll be able to tell, or the teeth don't fit together or occlude properly. There's something dislodged either in the joint, or the jaw can be fractured itself. Cavities, you can't do anything about, but if it's a toothache, that's a dental emergency. You try to prevent those by having regular appointments, but there can be swelling, there can be pain. Again, call me, get the emergency phone number, and we can either prescribe or come in to start some sort of treatment immediately. We don't want any child in pain. Teeth can be fractured or chipped and just a little rough. That can wait. It's still something that has to be treated as an emergency, but not immediately, meaning after hours or on the weekend. We can take care of it first thing when we open again, either the next day or after the weekend. Children can fall and break teeth. Baseball bats, balls, sporting events can cause it. And infants, what you have to watch out for that I've seen before is, although it's not as common anymore, is chewing on electrical cords. They can literally get electrocuted and not necessarily die or have fatal injuries, but it mutilates the soft tissue. Again, that's something that looks horrible and needs to go to the emergency room rather than here and be treated in the office. You need to go to the ER because there are a multitude of things that have to be taken care of, and it's not usually the teeth. It's usually the tongue and the lips that have to be cared for and treated by a plastic surgeon. And so, on that positive note, there are dental emergencies, but just know how to take care of those teeth if they're knocked out and what to grade those other levels of emergencies on. We'll always be here to take care of you. When you call the office, you'll get my cell phone number and you can contact me immediately. See you next week.